Hi, everyone. My name is Judith Okoro. I am a recent MPH grad from University of California, Berkeley. Today, I will be doing my presentation on how I designed interventions to increase physical activity among primary school children during the COVID-19 pandemic. This project began as a pilot study investigating the effects of three interventions on children's health and wellness during the ongoing pandemic. So, research indicates that for primary school children, sitting for greater than 2 hours is associated with increased musculoskeletal pain, increased risk of childhood obesity, lower cardiorespiratory fitness, lower physical fitness, as well as reduced cognitive performance, all of which may be negatively impacted by distance learning during the COVID-19 pandemic. This was a quasi-randomized control trial with 3 elementary schools in San Pablo, California. This consisted of 7 classes of 4th grade students, which amounted to about 76 participants. Some measurements that we were able to get with the limitation of distance learning were surveys. We were able to get BMI. We were able to get some posture and physical activity measurements using active PAL inertial measuring units. And we were also able to measure functional performance by having them perform tests such as the Y balance test, active standing leg raise, double jump, and toe touch. So now we had 3 interventions that we designed and developed. The first consisted of 8 20-minute interactive educational classes on healthy habits. The main objective of these sessions were to eat less than 25 grams of added sugar a day, sleep at least 10 hours a day, move for about 60 minutes each day, drink 6 to 7 cups of no and low sugar beverages, and watch less than 2 hours of non-educational screen time each day. All of this was made specific for the 4th grade students. The second consisted of 2 30-minute classes on ergonomics with a focus on changing postures to reduce prolonged sitting. The third involves the integration of pedometer-based step counts into curricular lessons designed to support physical activity during school and leisure time. A pedometer was provided to each student in one of the schools, and step counts were tracked using a log that incorporated operational math activities such as adding, averaging, and graphing. The teachers discussed these step count goals and incorporated challenges using the provided curricula. One example included students climbing Mount Everest by comparing their step counts throughout the day with the actual number required to climb the actual mountain. So to design these interventions, we use the Intervention Design and Analysis Scorecard, also known as the IDEAS tool, as well as the Instructional Systems Design Model, also known as the ISD model. The IDEAS tool used to design the overall study interventions is an iterative 7-step planning process that calls for collaboration between the design team and the stakeholders. We use the 5-step instructional process of the ISD model to structure the design of the trainings for each intervention. Together, these frameworks complement one another and provide a thorough and comprehensive participatory systems approach. So for this talk, I am going to focus on the design and development of the 3rd intervention because it is the most comprehensive of the 3. Using the IDEAS tool, we applied our selection criteria to the solutions that we came up with earlier using the IDEAS tool. One of our solutions was to design an integrated curriculum to encourage postural movement and physical activity. So for one of our solution activities, we decided that we wanted to design and develop an integrated curriculum to increase step count. Our scope was limited to one school, and this school had 24 students, and our goal was to provide strategies to increase physical activity throughout the day. Anticipated benefits or outcomes included increased step count, increased satisfaction from stakeholders, increased ownership by stakeholders, increased commitment to delivering the program by the teachers. Resources included the personnel cost of the key stakeholders, as well as the subject matter experts, and also the distribution of the education materials. Anticipated obstacles included teacher availability, especially since we were in the pandemic and teachers might be feeling a little overwhelmed. And another anticipated obstacles was that since these were fourth grade students, it was inevitable that some may lose their pedometers. The instructional systems design approach was used to develop the educational training programs for the study. So in the analysis phase, the team identified multiple contributing factors to the health problem. And this included a lack of physical activity and posture changes. Therefore, we hypothesized that increasing physical activity among school children would require a systems approach involving the child, their parents, and their teachers. So, providing a pedometer to each child and using tracked step counts in the student's curriculum with strategies to increase physical activity before, during, and after school may facilitate an increase in physical activity. In the design phase, the design team consisted of subject matter experts in the occupational health and ergonomics area. So goals for this training included providing strategies in and out of school to increase physical activity and posture changes, and using a pedometer to provide feedback on the step count goals. For the development phase, key stakeholders were actively involved in providing feedback to the training materials so that they could promote commitment and ownership of the training materials for their student learners. We really wanted to encourage parents to apply the training materials and the handouts to assist their children in setting up a comfortable learning environment that encourages postural movement and physical activity. So we provided them with house-based, class-based, and family-based activities that increased step counts. During the implementation phase, all interventions were delivered by the design team through weekly synchronous sessions. The teachers incorporated the step count activities as part of their regular curriculum throughout the week. To evaluate the training, during bi-weekly meetings, parents and teachers gave feedback on revising subsequent curricula and to encourage their learners to increase their physical activity and postural changes. In our summative evaluation, our short-term goal is to see an increase in weekly reported pedometer step counts, and our long-term goals were to see improved cognition and cardiometabolic biomarkers. To evaluate the interventions, we use Kirkpatrick's training evaluation model. The first level is the immediate reaction to the materials. There was a lot of active engagement and a lot of active involvement by the stakeholders. They really made it theirs, and we wanted to really make sure that we were not coming in and giving the stakeholders the interventions that they should do. We wanted to make sure that they were very involved in what they liked and told us what they did not like, and also gave us a lot of feedback on what they wanted to see in the interventions. One example was adding a mental health component to the Healthy Habits training. Therefore, the design team got together and we added a mindfulness lesson to the Healthy Habits sessions. The next level is the learning component. We saw an increase in knowledge for the fourth grade students in the Healthy Habits lessons. We saw this through pre and post lesson assessments that we used through a learning game called Kahoots. And lastly is behavior. We saw an increase in confidence, and actually, this was something that the teachers mentioned, that they saw an increase in confidence for some of their students through the Healthy Habits lessons. We also saw an increase in commitment and ownership by the teachers, by the parents, as well as the students when it came to the materials. Now, this project went on with some limitations, which included a small sample size, varied attendance, as well as the COVID-19 pandemic. So because of the COVID-19 pandemic, we were in distance learning, and it was hard to get objective measurements because the students only came to the school maybe once a semester to pick up materials. So this project is still ongoing. So the next steps are just to continue this iterative process of creating these interventions, making sure that the teachers and the parents are giving feedback, and also to analyze the end of year measurements and provide some pre and post analysis. Once the COVID-19 pandemic has passed and all of the students are in school without any interruption, we hope to implement some sit-stand desks. We hope to expand our outcome measurements, such as providing some cognitive tests, and we hope to have much more family engagement. So in conclusion, our summative evaluation has indicated a commitment and ownership of the materials by the parents and the teachers. And also, this study highlights how participatory ergonomics may help educate students on how these factors impact health and engage key stakeholders in supporting kids to implement healthy choices. I would love to thank my team for this project, and I would like to thank the University of Arizona for providing me with the resources to execute this project. Thank you.